Hi, I'm Dr. J. I teach computer science and I co-chair the Center for Creative Sciences with Dr. Keller. I just wanted to talk to you a little bit about blood donation today. I'm not a spokesperson for any blood donation organization. I just happen to donate blood pretty regularly myself, and I think it's something that's really important. I just want you all to know, as 10th graders, as people turning 16 years old, that you become eligible to donate blood when you turn 16. It's a process that can really save lives. People who go into emergency surgery for various reasons, a donation of blood can be literally a lifesaver for those people. So not everybody can donate blood. You have to be at least 16 years old, as I said before. If you're a minor, 16 or 17 years old, you have to have parental permission, and there's a permission form. A lot of the eligibility requirements, and you can read more about this if you want at redcrossblood.org. You can download the blood donor app on your phone. You can call 1-800-GIVE-LIFE, and they can tell you a lot more about that. But you have to be a certain size. And so you should look that up and just check and make sure you meet that requirement before you go in, so that you're big enough to donate. You have to have enough blood to spare to be able to give away a pint of it. You have to meet certain health requirements. If you're a male, you can't have had sex with another male for the last 12 months. There are various travel requirements, and if you go in to donate, you'll be asked a whole long list of questions where they check on your eligibility to donate. So you can't have had skin grafts recently, or tattoos recently, or you can't have traveled to places where there's malaria commonly, things like that. There's a whole long list of questions that they ask you to check to make sure that your blood is safe. They will test your blood some, but they really need to know going in that all the tests should come up negative, so that they know that they're getting safe blood. If you do decide to go in, I'll give you a little sense of the process. You go in, they give you a whole stack of reading material. You should read through all of that. It talks about different medications you can't have taken. You can't have taken aspirin within 48 hours. Tylenol is fine, Motrin's fine, ibuprofen, Advil, all that's fine, but aspirin in particular thins your blood, and so they can't take your blood if you've had any aspirin within 48 hours. There's also any other kind of blood thinning medication you can't have taken, and they just ask you all sorts of questions about where you've been, and in terms of travel, if you've been to countries where malaria is common, that's a big problem. And they ask you, if you've lived overseas and so on. So, and then when you go through all that, they do basic health screening, make sure your temperature is normal, make sure your blood pressure is normal, make sure your weight and height meet the requirements, and your age meets the requirement, and you have your permission. You have to have identification with you to prove that you are who you are. And they stick a small needle in your finger, or not even the needle, they poke your finger and draw just a couple of drops of blood out to test your iron and make sure you have enough iron that it's safe to give. And lots of people get turned down at that point for any one of those things. Your temperature might be a little high, your blood pressure might be high or low, your iron might be low. That happens particularly with girls. So don't take it personally. It happens all the time. People get turned away for the donation because of those things. And then if they decide that you're safe to go and you're ready to go, they'll sit you in a chair, and they'll stick a needle in your arm. And I'm not going to lie to you, it hurts. Sometimes they get some alcohol on the outside of the needle, and it burns for a little bit after they stuck you at the needle. It's a pretty big needle. If you really have a phobia about needles, it's probably not the choice for you. But if you can handle needles, it's not fun. I don't love it. I don't love getting stuck with a needle, but I also know that the need for blood is way greater than my need to not have some pain in my arm for a few seconds. The blood will drain out into a bag. They need a pint of blood. If it's a partial pint, they can use that. Ideally they would get a full pint. If you're well hydrated, well fed, and well rested, it can take 8 to 10 minutes. Not that big a deal. But if you're some people have smaller veins and it takes 20 minutes, and it's no big deal either way. Most people, it's pretty straightforward. Most of the time you go, they'll take some blood. You'll sit up slowly and stand up slowly, and you can sit down. They have a little cantina where you sit down and you can have some snacks and some juice, and get some sugar back into your system, get some fluid back into your system, and help your body recover. The first time you do it, you should definitely spend 15-20 minutes sitting, drinking some juice, eating some snacks. They have pretty good snacks, Oreos and trail mix and Nutter Butters and whatever, all sorts of things to eat, and orange juice and cranberry juice and stuff. Make sure you feel better before you walk away. So it's a really important thing for people to do. It's a huge, I mean, it's literally a lifesaver for the people who need it, and it's something that you can do. It's perfectly healthy. It's perfectly safe. Everything should be fine. I do it all the time. I've done 5 whole blood donations this year and 3 apheresis donations this year. And I'll continue. I'm setting up an appointment for my next one coming right up. If you donate whole blood, you can donate it every 8 weeks. You become eligible again after 8 weeks. It takes a little while for your body to replenish all of what it lost. Hopefully you can do that. If you have any questions, feel free to reach out to me. I'm always happy to answer them. And as I said, I'm not a spokesperson. I just wanted to talk to you about my experience with it, and hope to encourage you to try it out yourself.